Good morning, ladies and gentlemen. I'm Jun-Dong from Hallyu University, Seoul, Korea. The title of my presentation is Third Generation Ceramic on Ceramic Bearing Revision Total Arthroplasty. This article is impressed on Journal of Arthroplasty in December of this year. The prevalence of revision total arthroplasty is substantially increasing not only worldwide, but also in Korea. Conventional ultra-high molecular polyethylene for bearing surface has been mainly used in Korea since total arthroplasty had been performed. Wear and osteolysis were particularly in higher in Korea due to different lifestyle and relatively young patients compared to a Western country. We have documented this background with severe metallosis caused by impingement. Furthermore, we found similar characteristics of revision patients to primary total arthroplasty in other studies regarding revision total arthroplasty. Then we can say bearing surface is an issue in revision total arthroplasty. However, there are few studies mentioning about bearing surface in revision total arthroplasty. Ideal bearing surface in revision total arthroplasty should be the same as in primary total arthroplasty. Available current option of bearing surface can be used for revision total arthroplasty. However, each alternative bearing couple has advantage and disadvantage. Cross-linked polyethylene do not have long-term result, produce smaller particle and stiffer, and metal-on-metal may have risk of serum ion level, hypersensitivity, pseudotumor, and possibly long-term toxicity. And fragility and squeaking are the concern of ceramic on ceramic bearing. During revision total arthroplasty, the strategy for selection of bearing couple are required according to the previous articulation. After ceramic on ceramic bearing, in case which has third body, we should not use metal head. The purpose of this study is to evaluate clinical and radiographic outcome of revision total arthroplasty with use of third generation ceramic on ceramic bearing in relatively young Korean patients. 42 hips of 37 patients which could be revised using ceramic on ceramic bearing were analyzed. The average follow-up period was 5.4 years and average age was 48.8 years. Most common pre-op diagnosis was osteonecrofemoral head. As causes of revision, retroactive osteolysis was observed in 36 hips and stem loosening in 26 hips. Among them, 40 cups were well fixed and pelvic osteolysis was most frequently observed in superolateral area. Femoral osteolysis observed in 36 hips. Majority of the retrieved cups were Harris-Gallant cups with average cup size of 55.2 millimeter. Most common retrieved stem was anatomic stem. Mean annual linear wear rate was 0.17 millimeter per year. For Acetabular revision, triple ceramic cup in 22, EPP plus in 14, and dural option in 16. Average cup size for revision was 56.9 millimeter and 28 millimeter head was used in 28 hips while 32 millimeter in 14 hips. For femoral stem revision, Wagner stem was used in 22 hips, SL plus long in 14 and S-ROM in 6 hips. Extended trochanter osteotomy was performed in 36 hips and 21 hips were required bone graft. At final follow-up, Harris hip score was 90.13 and no revision was required during follow-up period. There was a few complications including two dislocations. There are no radiological findings related to loosening and osteolysis at final follow-up, especially where was not measurable. Bone graft was incorporated in all cases at final follow-up. Unlike shows referring to several cases. 50 years old male patient with extensive osteolysis and line dissociation was revised after 16 years of primary total arthroplasty. 48-year-old male patient with bilateral total arthroplasty operated 15 years ago present with extensive osteolysis and loosening of the cup. Both hips were revised successfully with ceramic on ceramic bearing and bone graft. 49-year-old male patient was revised for loosening of femoral stem. 24 years after primary total arthroplasty, 62-year-old male patient with metal myocup and stem was revised loosening. 45 male patient were revised after 10 years of primary total arthroplasty. 56-old female patient were revised for loosening of cemented femoral stem after 12 years. Discussion. There are various methods of acetabular cup revision, including cementless cup. To use ceramic bearing, cementless cup should be used. In our previous study, cementless cup could be used in 82.3%, not in all the cases. Therefore, more thorough pre-operative preparation should be prepared for revision total arthroplasty. Revision is the most common cause of dislocation. Therefore, more attention should be paid for exit cup position. Furthermore, large femoral head can be considered for prevention of impingement and subluxation. In our study, tooth dislocation occurred in the case with 28 mm head. If femoral stem to be remained, most staples should be intact for use of ceramic head. Otherwise, the biologics option can be one of the options. The patient who require the revision in Korea like this are still relatively young, therefore bearing surface for revision should be important as primary total arthroplasty. In ceramic bearing for revision, the fragility is one of the concerning as primary. Recently improved the quality and design of ceramic bearing reduced these concerns. Implantation technique is also important to reduce complication. Proper positioning of cup and stem are essential for prevention of impingement. Concept of combined anteversion and navigation assist implantation could be helpful for exact position. Squeaking is an important issue and the instance has been variably reported. The instance in Korea is low and the proposed cause remains elusive and multifactorial. However, it is likely related to variations in surgical technique, patient selection, implant design. With continued improvement in design, material, component positioning, squeaking following ceramic on ceramic total arthroplasty can be minimized. In this study, there was no squeaking and fracture follow period. Conclusions. In our study show favorable clinical and radiological outcome after revision total arthroplasty using third generation ceramic on ceramic bearing. Thank you very much.